free. My name is Karen Bailey. I'm just going to introduce myself and my cohort over here, Christina Davis. I've been working with those on the autism spectrum for close to 20 years. It started out with working with those that have Asperger's, and just really having the privilege of discovering that some of the children that I was working with in home counseling was actually not just oppositional, but they actually had something else going on with them. And I was able to get them diagnosed through through testing, and through that, it began this process of understanding and learning and working with those who are on the spectrum. And I'm happy to share some some information with you today. And Christina and I have been starting a program in our CSB that's really specifically for those who are on the autism spectrum and also have intellectual disabilities, and for therapy particularly. And so there's going to be some times that we're doing a dialogue together, and we want to encourage you to join us. Most of you have had some kind of touch with or have done a lot of work with autism. Everyone has a different story. And we would just love this not to be either my lecture or our dialogue, but for you to join in, because that makes that's how this becomes more richer for all of us. So that's where I wanted to get us started with. Let me see. We can just get started here. I'll put my PowerPoint up and get our stuff there. Let's see. Okay, so there we go. Oh, let me get the full one on. Here we go. Now, I feel like when I think of, we were trying to give up topics so that you can actually have maybe some specific knowledge about some things. I've done several other trainings that were more broad and just understanding autism. And I always have to tell myself, people write books on these topics. So I'm just always going to be more like, this was challenging. I know I could have probably done 2 or 4 hours on one of these topics instead of deciding to do 2 topics in this area. But I feel like this is a good touch point. This is for you, like a launching pad for you to learn some new information. Also in the chat, just feel free to ask questions as we go along. And just kind of feel like, when something comes up that you're thinking, but what about this, or what would be a linkage for that, or anything like that? That's part of the purpose of this training. So let's see the next. So this is my schedule. This is part 1 of the schedule, which is about anxiety and autism. You'll see that when it comes to autism and anxiety and ADHD, that they kind of marry together a lot. There's a lot of things that really, when you do the interventions, they help both. So that's really going to be important for you to recognize. But I was pretty detailed in this. Usually I put a couple little like bullet points, but recently Christine and I went to a training that was on autism. There was a lady there that she was very detailed, because this is an example of what I will speak on. I'll speak on later when we're talking about having visual aids and being predictable, is that those who are on the spectrum do best when things are visual and when things are detailed. So this is more detailed than you may need, or I may need, but it's something to kind of represent that this is what often our clients on the spectrum need, is a little bit more information and not vagueness. And I say this also because sometimes as parents, it's easy to be like, to kind of like, I'm the parent, come with me and knock it off. I know that sounds disrespectful, but that's somehow, the mindset of sometimes we just, parents had parents who said, I'm in charge, so just listen. And that's not like wrong, but sometimes that's not enough information. And sometimes we can reduce anxiety, and we can help our those who need help much more when they have this kind of information that's real detailed. So that's why there's more information, and that's what we're going to be talking about in the next hour or so. Okay, so here's our video. Give me a second. So I'm going to start with asking Christina, and all of you want to, as you participate, Christina, what have you seen when it comes to autism and anxiety? Do a lot of your clients have anxiety?
I'm going to say that a majority, probably most of them, do have anxiety with a diagnosis with autism. Yes. I often see that they coincide together.
That's my experience as well. I would say that all of my, if someone had said to me, why would they need to go, like, I think of the doctor, there's no medication or for autism, like in the sense of like, this is going to correct autistic behavior. But why would someone get medication? The first thing I think of is anxiety, because as I say, they always need it, but I'm just saying that that's what I think of, because the inability to predict their future and their inability to manage social situations, that this is a part of their life, even if they don't necessarily meet criteria for an autistic diagnosis or haven't yet. That's typically what I noticed with whether I'm talking about children or adults that way. What have you noticed that the issue is with your clients?
The biggest issue that I've noticed with my clients is the unknown for them. Not knowing what's going to happen ahead of time, not being prepared, not having knowledge of any changes that could possibly happen along the way.
Yeah. All of us can get stressed if there's something that happens that we're not really planning. It's a lot because of their sensory issues and just the way neurologically they're a little different than the neurotypical person, that it can be it takes way more energy for them to kind of manage it. Let's see. And this is why we wanted just to discuss how this is true. For my clients, this is just a rough snapshot of what I have learned about anxiety and what can trigger it. And it can be as simple as the fact that my clothes aren't comfortable. Noise is because as we will talk about in time, their sensitivity to sound can be very significant, and it can be an issue. Unpredictability, as we've shared, anticipating things that are, especially if they're unknown, or even fun things, things that they like, can be difficult. It can be any kind of experience. Now, interoceptive may be a new word to you. An interoceptive experience would be is the way how my body is feeling inside. So I can be anxious, not because anything out here has been bad or different, but because inside maybe I'm feeling more, my stomach is I'm feeling my stomach too much, or my feet are kind of hurting because we walked a lot yesterday, or it could be a lot of different experiences. Is there any there, Christina, that you've experienced that?
Yeah, with a lot of my clients is the noise, it's the clothes, it's the interoception experience that they experience that causes their anxiety.
So regardless of what's going on around them, which could be very positive, there's always this internal piece that is happening that can be more than we're aware of. We could understand if they were in a new situation or something was changed, but sometimes we're not always aware of what's really going on inside unless we ask, and they're able to communicate that, because not always can they. Let's see. So I'm going to read a poem. This is a way to begin. Kim Clary, you'll see on there is her information in her website. And the reason that Kim, I'll say it this way. Christina and I met Kim we saw her a few weeks ago in a training that we went to for autism, and I just really enjoyed her. And she is her backstory, you can see more on the website, but she was in her 20s when she was diagnosed with autism as well as sensory processing disorder. She is an occupational therapist as well. So she's delightful. So I wanted to read her poem in honor of her, but also because this is a great discussion, and I would just really appreciate you sharing. And again, before I share the poem, I want you to If you're new, you've come just recently, if you haven't put your name in the chat, please do. So we have a record of your attendance. So this poem is called My World, Your World. I have eyes, ears, and a nose and a mouth just like you. I look like you. I go to work like you. I even blend in and act like you, but I am not like you. I am me. I am different, but yet forced to be indifferent to the ways of this world, a world that befuddled me, where yes means no, where smiles are upside down, and kind words harbor hidden meanings. This world perplexes me. Hidden agendas lurk every corner. Rush hour really lasts 24 hours. Assumptions equal facts. Pleasantries are not just routine. No one really cares how you are. How do you live in a world polluted with noise, a contamination of it to the ears, buzzers, banging, beeps, yelling, shouting, slamming, ringing, all ruckus to the ears, everyone talking at once, yet no one is listening. Content is lacking, irrelevant. Sadly, these words wasted, time taken, discovery stolen by wasted words, by these wasted words. Are you really listening? While the contaminated ears are clogged and the muted mouth spits out meaningless musings, the eyes are blind. Not in the literal sense, but the eyes, they don't see. They don't see me, they don't see you. They don't see themselves. The eyes are distracted by blues and greens and grays, reds, yellows, and all different colors. Colors are of various shapes and sizes, blurred together, oscillating, vibrating, moving colors, camouflaged. Your colors are seen by your blind eyes. They create false pretenses. Colors are meant to be felt, not just seen, like ears are meant to see and mouth listen. The world is backwards, thwarted, confusing, yet I must live in it and learn your ways, or I am labeled aloof, cold, rude, uncaring, antisocial, anxious, defiant, odd, or not normal. Assumptions are made that I am unfulfilled, unhappy, and sad because I do not find pleasure in the emotional and objective pleasantries of your world. But assumptions are not facts. My world is different, but yet we are in the same place. I hear and see, touch and smell things sometimes you miss. It is wonderful and beautiful, really amazing. I want to say, come with me. I want to show you, but my words are fragmented, my mouth unable to speak. Too many things around me. I want to take your hand and show you what I can see with my ears and hear with my eyes, but I am paralyzed. I cannot move. There are just too many things around me. I find that very powerful. What is your reaction to hearing that poem? You can either speak out loud or you can put something in the chat if you have, as I experienced it. What was your experience when you heard that first, Christina?
The first time I heard it was touching and moving, and it made you realize things that you're aware of but you really didn't pay attention to.
Yeah, actually, I see someone saying sadness.
Saw it. Can you hear me?
Yes.
I heard it and it was for me like an invitation or opportunity to get to know a new person. to this world. And I say that in the line where it says the world is backward or things are backward, and I have to learn your ways. So I felt like that was an opportunity for me to, hey, there's somebody new here.
Thank you. That's beautiful. Anyone else want to share?
I had a lot of the same thoughts that Marilyn did, but also, I also realized how complicated our society is when you were saying things like, we're not really asking how you are, or, yes means no, and our smiles are upside down, because I realized how much vagueness our culture uses to be polite, but really it's not being explicit. And then that makes it more challenging for people that do rely on those social cues and the directness that, that they're not getting that. And that makes it 10 times more challenging.
Agreed. It's like the judgment. When you were saying that, it made me think of how in the part where she says that, yet I must live and learn your ways, or I am labeled like this. And it's like, yeah, that's right. You are right on, because that would be, or that if you don't live like I do, oh, you didn't say nice things to me when I said hello to you, then that means you're this, or you're unfulfilled because you don't like life like I do, which is pretty limited and disrespectful. But so remarkable how she put it. Thank you. Anyone else? I was able to share this week with a client, and it brought up a great discussion. It kind of calmed her, but also it was like I had a little key to share with her, like I am learning things that are like, so I understand you better. And she's an adult client that I have that has autism, and it just was, it began a good conversation. And I know that we'll probably go back into that. One of the things that I would say on the general level of what Christy and I learned from the training that we did 2 weeks ago, was how much everything is how much auditory is difficult and visual is more of their strength. I'm not saying that everybody is always like that, but when you think about people typically who have autism, that's why often the actual where the head, the noise cancellation had said because of the noise. They usually don't put blinders on their eyes. So that's just things to be aware of. And it's something I've been aware of for a while because I just know I've had clients for a long time where noise in like in lunchrooms and gyms were like the worst place to be because of that, or like I think of like stores like those box stores like Lowe's and like Home Depot and things like that, because of just the nature of there's a lot of opportunity for noise in that way. So let me just pull up this, share my screen again here. So as we've been talking about it, I just want to just kind of recognize as we're slowing down. One of the words I had been practicing this poem because I wanted to do it right for her. And, I wanted to do a good job for saying it. But there was a specific line in it that was where it says rush hour really lasts 24 hours. And in my brain, I was like, I was like, that don't make any sense to me. But then it took me like saying it 3 or 4 times to realize, because we rush so much. When we talk about the word rush hour, we're thinking about like, in the morning or when people are coming home, we know what that, but really she's talking about how much we rush. So I would say if you are in any kind of leadership position as a therapist or in any kind of, as a parent or any role with somebody who has autism, is recognizing how much we want them to kind of rush, like kind of get to our speed. And sometimes it's recognizing that we need to slow down. We have to watch our cadence. These are things that we're going to be talking about. So as you would see in my, as I wrote here, like just recognizing and walking in compassion, because sometimes like I was repeated, I've heard many times, and I'm sure you've heard it too, is that when they say, if you know someone who has autism, that means you know one person that has autism. Because as I have worked with people over the almost 20 years, I could say, everybody's different and beautiful. You know, they all have some are, you know, there's just all different strengths and challenges, and everybody's in a different place. So it's important just to recognize and invite your, you know, them into your life, that they will learn from you, and that you will learn to like kind of pace yourself with them. We learn things as we slow down. And this is what I learned from her. We watch and these are things of watching that your words aren't too large. I've said this several times in my other trainings. I recognize, you know, I'm obviously, I'm a therapist. I know some big words, but so what? Nobody cares. What's really important is that my client knows that I can speak to them and that I can pause. Sometimes if you use a word you use sentences that are too long, and you don't give us an opportunity for them to stop and to hear, then sometimes it goes whoo over their head. It's not that even when they're intending to hear you, they might miss you. And so that's always something to watch. And sometimes when I say they have a harder time understanding what really happened, what I mean is that sometimes if you ask somebody, well, like something just happened, and you're like, well, you want them to share an event. May not understand what happened the way you would, like you would want me to tell you if you asked me that question. And so kind of recognizing that sometimes what we think of, and if they say, I don't know, we can take that as like, well, they're either being aloof or something. And sometimes it's because of their sensory input. They may not get it the same way, or be able to, I'll say, explain it the way you and I would. And then and just being comfortable with asking for clarification, you know, giving a moment. When I think of that, although I also think of like, sometimes I raise my hand. I'm teaching my clients, especially if they are the ones that are more talkative, is that they don't always know when to pause themselves. And so if I'm just telling them respectfully, part of learning social skills is that I'm raising my hand. If I raise my hand, it's not because I have a question. It's because I'm just encouraging you to see, well, this might be a time to take a breath so that somebody else can like respond to you in that way. Other things that we are encouraged is this in terms of encouraging emotional regulation. So when somebody is anxious, again, slowing them down and deep breathing. So when you notice somebody is walking, is struggling with their anxiety, or they're kind of getting ramped up, is recognizing how to encourage them to have a deep breath. Now that sounds really, sometimes people look at you crazy when you say it. They might say, people are used to that buzzword, but actually encouraging it. And some of that starts with you. How I have my cadence, it affects the way right now, even how you feel. If I rush up my words and I have to talk really fast, it changes things. If I'm calmer and I just am like, and I'm talking to you this way, it can make a difference. Using statements like, it's going to be okay, you can do this. And really teaching them to say these statements in their anxiety can make a difference. There's a book that I have, it's a children's book. It's called I Can Do This. It's around, but of course I don't show that to the adults because I don't want to offend them, but it's really a very true thing that if we start to, because the way our brain works, if we default to our brain will negatively go like, I'm not going to make this, I can't handle this. But the truth is really, you're going to be okay. And if we focus on that we can do this, and we did it the last time, then we just kind of get those neural pathways going in that positive direction. It is always a fight. It's a fight for everybody, but it's a way to kind of help them it can be a statement. Small statements can go farther than a bigger way. Also want to encourage to recognizing what stemming is and encourage and accept it. And it was mentioned earlier what stemming is. So Christina, what kind of clients have you had, or what kind of stemming have your clients had that you've just experienced?
A lot of my clients, their stemming behaviors are flapping their hands, clapping, pacing. And those are probably the bigger ones. It's just the clapping, the pacing. Sometimes they flap their hands, or I have one that's very repetitive with words.
Yeah, I would say some of mine are those are similar, or like kind of shaking things, or kind of rubbing their hands together and needing to go like this to kind of get some of the energy out. And sometimes we can see this as being aggressive, but maybe it's just that they're, to kind of recognizing, are you struggling? And that we can say that maybe they just need some space. They need to kind of get it out. Anxiety can happen because we're sitting too much, which can look like ADHD, but it could be just that also, if I'm waiting too long, I don't know how to handle it. So having some stemming or having to deal with people too much, I might just need to go out and do something. I have this little, having my little fidgets, like little things that can kind of, the texture of this is stem, can be nice. There could be other toys things that can be helpful for them to have. But if they need to do something, it's not being like shame on you because you feel that way. Sometimes, stemming could like we just never called it that, being a kid, but, people cut, biting their nails, that's a stemming. It's just that it's more of a socially acceptable one, although we don't really encourage it, of course, but it's one of those things. It can also be that the need for something oral, and sometimes kids would chew on their clothes, and so we give them something else to chew on so that they don't obviously ruin their clothes and get them all wet. But sometimes that's a way a way for them to kind of calm themselves down. Just like I don't want to say like an infant, like to disrespect people, but that oral need is often can be there. And sometimes they need time and space, which we'll talk a little bit more about that as well, in that way. While I'm yapping about anxiety, I would just encourage you, if you have a client, you're thinking, if you know somebody that you're thinking they have, that's on the spectrum that has anxiety, and you're wondering, and you question about that, or you wonder about something, like as we're talking, you're welcome to just kind of put it out there. Hey, I have this issue, or I wonder, or that's just, feel free to do that. Christina will be my Vanna and tell us when there's something coming in. So this is just a statement that I want to just encourage you to ponder. Watch and notice when you're communicating. Does it command an answer and authority? Does it invite the person to share? And it is really just a practice. Nobody's perfect, but it's kind of recognizing how often we, especially if we have a role of authority as somebody in a position where we're working with them, or whether it's like as a parent, we may say, I need you to do this. But sometimes when our tone is a certain way, we can be shutting someone down when we're really wanting them to explain, how they're doing right now, so we can move forward and help them move forward. I really liked that video because it kind of broke down what I was going to say. And I want to just encourage you, if you have any experiences with, those of you working with, it's really helpful to look at what their toolbox should be. And so if you know someone in particular, this is a question that you could be asking them or helping them work out as an intervention. And she went through 3 areas, and it was like the sensory feedback, which was stemming, which we had already discussed, walking, other exercises. So again, what I like to ask people is, what are you doing? And what can you grow in this area? Again, it's almost, this is the way they fill their box up. This is how we take care of them. We help them to learn things. Sometimes there could be things that they're not thinking about because, if they haven't tried it, they may think no, or they don't know about it. And it can be that we're just exposing to new ideas, getting them out more, trying new things, even showing, sometimes for us, because I'm been doing more virtual, is to show them even videos of people doing different things that can be like, well, what can you try something different in that way? But walking and kind of getting outside, or sometimes just sitting down and having a quiet space, or actually that's the relaxation one. I'll just go right into that. So the first one is really trying to get something out, and the other one is relaxing. So is there space in the schedule? Is there time for deep breathing? An easy thing to have is really to have, like, can they blow bubbles? Even though I know as adults, that can sound like I'm too old for that. but sometimes it's really silly to do that, or blow balloons. Those are ways of, can be like getting a deep breath, but it's not as, I don't know, as, it's more concrete. It's more concrete to see a balloon blown up and having to use that breath than it is, or to blow out balloon or blow bubbles, than it is to say, take a deep breath. Sometimes people don't always get that. I know grown-ups who that's a challenge for, who don't have autism. So it's important to kind of do that. And do they have a space? Often when I think of when people are struggling with anxiety, sometimes they can get a little, like maybe they're stemming, or maybe they're just and they start to get agitated. And often people will be on them like, what's going on here? I need you to, can I help you? Why are you acting like that? And often the most that they need is just a minute to calm. I just have a picture in my head of a 6-year-old I worked with a long time ago. And I remember being at the library. This was in-home counseling. And he was just having a moment. He went under the table, because that's 6 years old, that's what they do. And they went under the table, and at times people were saying things, and I just said, he's going to be okay. And he did. He just kind of calmed right down. And then he came out, and we just had, there was nothing else remarkable about our time. It was fine. And that sometimes we agitate people when we're like in their face, when they are already struggling. That's, if you want to, that's almost like a guaranteed way to get in trouble, to cause a problem, is to actually ask people when they're already distressed, if you're demanding something from them and saying you need to obey and you need to do these things. But recognize, if you just give them a minute, they might calm themselves down a little bit, and then they'll be able to do something. I mean, obviously, if it's a safety issue, that's different. But we're just talking about in general. Christina, have you experienced that with your clients?
I have. I've experienced in sessions when they're having a moment, just to let them kind of do their, work through it, and then we can come back on track, because agitating them more is not going to get anybody anywhere. Karen, in the chat, some people have asked you to post the link for the resources, and then someone asked if you could share the toolbox suggestions again.
The one that's from the her video, I can pull up that. I can do that. Let me do that at the end. I can show you the video link, because that way I can, I really liked her sensory, but this is what she was talking about. And we'll go through that, and I'll show that link again. So part of it is also asking the client what they need in that respect. So, tell me, what are some of the special links that special interests that your clients have? And you could, if any of your clients have it, everyone else, but Christina, you're welcome to share as well. Christina, what have yours been?
I've had clients who have had special interest in the military, big on gaming. Someone just mentioned gaming as well. Sports. I currently have one that's really big in sports, so I have to become educated in that.
So is that actually playing it or watching it?
Watching it and knowing every single fact about every single game that has ever happened and trying to talk about it.
It's no joke. I've had ones that were interested in like building things. I've had ones that have been interested in like the states and the flag, like just like state and history information and any kind of historical facts. And I've had those who understand science and that interest. I have, sometimes I've had clients where their special interests become challenging because they have interest in the police, and they're very concerned about their safety and that sort of thing, which is a whole different trauma issue. But they often do have special interests. I had, or the weather. Weather is often one that's often enjoyed. And one of the things that we just also with Temple Grayson would suggest in when I heard her speak is that this is a way to expose young people to different topics. One of my clients is actually very good, an avid fisherman. I mean, so he's got the right equipment. I have another one who's very much a researcher, and anything that he buys, it is like he could tell you why and all the reasons. So these are like interests. Like I have the one that who likes fishing and likes to be outdoors. He's actually going to go into welding because he really wants to, his goal is to be an underwater welder, which is super cool. And he will be able to do that. So I want to just say sometimes a special interest, this is a way for families to recognize how they expose children and young people to these ideas, and that could be something that can become a career or an opportunity to just really grow in a hobby, but it could actually be some way that they make money as an adult. Sometimes we can see that as like something not important, but it actually could be very important in the sense of, and I think of some people, I just wonder how many of the scientists that were successful, they do speculate on people like Einstein and other people that they really that were possibly autistic because they didn't do well in school, but yet here they could focus on something, ridiculously focus on something until they achieved amazing success. And so that sometimes our scientists are like that. And we think they're they're a little different than the rest of us sometimes. And, that's awesome. So I just want to encourage you that sometimes that's the joy and the strength of every individual is their special interest and how that can really make a difference for them. And it can also help them to kind of build again their toolbox up. And the other part of that was, I'm trying to change the subject. Okay, so it's really kind of recognizing that the need for a schedule and that this is another way to kind of so there's not as much to take out. So I'm asking you to have fun. And I'm asking you to either do a schedule. You can either write one out, like, you take just a piece of paper and write out if you were either telling like somebody your schedule or the task that you need to do today. I'm asking you to do this not because like it matters to me as much as that it's getting you in the habit of recognizing, well, what am I doing today? Well, I'm doing this training. I have some other work to do. And then I'm going to, do these things in the afternoon. That may seem like a minor thing to you, but with someone who has on the spectrum, I want you to kind of get ready to like show them a schedule that you could say to them, what are we going to do? One of my clients' mothers told me that's what she does every night before one of the evening activities is to say what tomorrow is going to be like. And it's also like, sometimes we're so oriented towards our phones that we're not always, that we just kind of have it like, back in the olden days, where my parents had a paper calendar but I would just say paper calendars are awesome because you can put them up and it's important it's not just for you, it's for everybody so that they can look at it and they can put stuff on there. Maybe it's for them to say, you are going to do, you have chores to do. What day do you want to vacuum? It's certain things to ask them that you can help them to be autonomous in and give them tasks. This can also go along and help because, sometimes they need to see it. And it can be just helpful to recognize that they do that. Is that a challenge, do you think, for a lot of parents or clients to actually write for family members and for therapists to do that? I think even Christine and I had talked about like when we're even in session to say, this is how the session is going to go. When we're talking about, we're at the end of the session, we're going to be, as I get towards the end, I'm going to be talking about these things, about like that what we're going to be doing, what I want you to do for homework or what I want you to practice this week. When I say those words, that means we're almost done. And I'm probably going to tell you when the next appointment is going to come. And that's a way to kind of help them because even in our appointment that is only an hour long, they may not always be aware, of the time. It's like, oh, okay, now it's time to go. So that's just something important that as they're anticipating things, it's really helpful to recognize that. Anybody have any comments about like being visual or like even asking you to write this out, what that's like for you?
There was a comment in the chat that with single parents with multiple kids and full-time jobs, it can be a challenge.
Mm-hmm. Absolutely. So it can be something that, and I get that. So maybe just a little planning. It could be, so we've seen is like, you can have a laminate, you can have something or the schedule's already up this is what we do. And then there can just be a few changes. One of the things that we saw that they explained is even having little cards that could be like, there's a change. And that's something that we'll talk about a little more about some of how we can use different tools to kind of help it to be flexible and fluid, but even having the things up on the wall and that they get used to doing that. If there's a schedule of what they need to do in the morning, like it can be put up once every morning. This is what usually is supposed to happen. Not that there can't be changes, but having that up can be something that then they know they can go to, and it can either be words if that's what they're, that they're old enough or they have the capacity to understand, or it can be just pictures, and they can even draw pictures next to it so they know, and that you're teaching them to get to defer to that. As much as it seems like that seems challenging or like it could take time, it's almost like time in the bank for later, because if they're looking at it, then you're not having to. Even was talking to someone recently about, how executive functioning works, and that, just being able to tell a client, if you tell them too many things at one time, they may not get it. Well, sometimes, and that is true, that's more an ADHD issue, but with autism as well. But at the same time, if you give them a piece of paper that says, I need you to do these 5 things, they can refer to the paper instead of you when they're ready for that. It's not necessarily ready right away. But that's just something to consider in that way, because visual can go a long way. And if that means drawing, that would be helpful too.
Karen, in the chat, some people have mentioned unexpected events can throw off the entire day or even the week. Visual schedules are very helpful for autistic children. And then someone had mentioned a Velcro schedule on a board for children as well.
That's great. That's great. So we will talk about the change card in a little bit, which really is to kind of help introduce the concept that change is okay. So we'll talk about that during the ADHD section. So many of these things I had to figure out, just kind of divide it, because ultimately there's just a lot. There's so much overlap in terms of the 2 topics that will be helpful for them. So this is one of my state co-regulation, which any of you who are with a client who has autism, you are the co-regulator. You are the one that can help. And their emotional dysregulation. So co-regulation reduces their dysregulation. Acceptance and kindness helps someone move forward. And sometimes just a deep breath for the 2 of you, and recognizing how do we do that. So it's time for a little bit of break. So this is our transition. When we get back, we'll be talking about ADHD. It is now 10:57. So I'm going to say, like it's 7 after, we're going to get started with the next part. Thanks so much. I realized that when I was looking through my, we've already gone through, that there was a slide that I didn't share, and I just wanted to kind of go through that first. So we had just been going over the toolbox, and then the next line is just really recognizing that the importance of predictability. And this really does apply to both, again, anxiety and ADHD. I mentioned some of these things before, but I'll kind of go through this. It's you reduce the emotional changes when we talk about being predictable as much as we can, which is what we talked about. So the routine of recognizing and helping them to incorporate a routine. Some of these things we already talked about. And I started mentioning the surprise card. Now the surprise card was, she did a really cute example of that. And she just had, and part of it was just really recognizing that is having a card that really is just a surprise and says surprise is okay. And she even suggested, if you have especially if you have a younger person, is to really if there's a favorite action hero, or if it's, their favorite Disney character, and to put it on there and says, almost like they had one there that my brain remembered was it had a little bubble that said, and it's John Cena, and it says, John Cena says, surprises are okay, or change is okay. And part of it is in having a card that says, sometimes this happens, because we all know that's what happens, that sometimes surprises happen. We're not planning on them. And sometimes they're good surprises, and sometimes they're challenging surprises. But recognizing that it's going to be okay when it is a surprise is very helpful. And I thought I wanted to share that with you and so that could be something you think about that you could use for yourself. I also like to say, when I say communicating what's going to happen in a meeting, what I mean is that if I am saying we're going to do these things, sometimes not just like what I had shared about like in my therapy session, but I had clients where I would take them when I did in-home, we would go, if we would go someplace, especially when I think of something like Walmart. Walmart, if you told me, if I'm your friend and we're going to Walmart together, I might not want to go with you if I think you're going to like do your monthly grocery shopping. But if you told me I'm just got to pick up this, and this, that would change. Oh, you're going to be there in like 15 minutes. That's not a big deal. And those who are on the spectrum, that's really important. And I had noticed that when if I would go into Walmart with a client, and if I told them we're going to pick up these certain things and gave them just a broad stroke, not like I told them I gave them the list, but you could do that, then that made them feel they were participating. It did make them reduced their anxiety because then they didn't have to worry about it. They just knew that these were the things that we're going to do. Oh, we still haven't picked up the stuff for the car, or, oh, we hadn't gotten that, the cough medicine. And then they knew that and they were participating in it. I know sometimes that's not always easy, but even just telling them, oh, we're going into the store to just get these things. Oh, we're going, we need to get, we're going grocery shopping. That will help them to anticipate how much time it is. It doesn't mean they're going to be excited about it, but it can reduce their anxiety because they can understand, they can participate with it. On to ADHD. So again, here's my schedule. So we're talking about different behaviors and differences. Again, predictability. We're going to talk about sensory discussion and space. So to Christina, we will start to ask, what is it? What has been your experience with what do parents ask you when this issue comes up?
The biggest question I'm asked in sessions by parents is if it's their ADHD or their autism that's causing the behavior, and what can we do about it? Those are the biggest questions that I'm asked.
Okay. And so what is it, what do you do with that question? Like how do you help them break it down, or what do you do with that?
I honestly give a kind of a generic response of we don't actually know which one it could be because they're so similar that we kind of have to decipher by knowing the child. But I mean, we don't know, depending on the moment and the time of day and what's going on could be what it is and what it is not. So I don't give a direct answer because I don't want to mislead them.
Right. I think when I hear that question from parents or family members, it's usually like, do I discipline or do I give compassion? I feel like it's more based on like they feel like if it's ADHD, you being bad and in the corner or something. And if it's autism, maybe give more grace, which I would like to just switch all of those over and just say that we all need grace, and that we all need, because it's really understanding. It's kind of like not when, if anyone's had like a puppy, I'm not reflecting, comparing human beings with puppies, but we have all know this story, if you've heard of it, where somebody who got a puppy, thought it was so super cute, and then but then they trashed their house. They like, chewed the couch up, some, really can destroy things. And, in the end, it was really because the owner didn't understand that what they needed to do was they needed more exercise. They needed certain confinements. They need certain things to change. And the same thing I feel like with those who are on the spectrum and have an ADHD is that usually it's not because they're just, there are sometimes everybody has a choices of making, I'm going to defy you right now. We all, everyone. So that is always an issue. And if it's an issue of that, then there should be a sense of, a consequence. But sometimes it's about, I have ants in my pants. I don't really know how to manage this behavior. And so and then that's why I act out. And so sometimes it's giving compassion. We have to understand it. Now, our reaction, sometimes it's hard to be patient. Let's be honest. When they have lots of energy, it's harder. And at the same time, we have to kind of look at the bigger issues as to what's going on around there. And that's how we can help them. And recognize when we should give maybe more limits versus saying it's punishment, because sometimes we just need more containment. sometimes, or sometimes we need to be like let loose and going out. And how do we respond to, so like overstimulation can be hard for both of these. So what we did is a fancy Venn diagram. And so in this diagram, we're just kind of like, there's probably more. If you guys, all of you, there's a whole bunch of people here. If you feel like there's some that would go either in one or the other, or it would belong in the middle, put in the chat. This is, I can add it to it because I feel like this is what we want to see. So in autism, we have social and communication issues. There can be some of that in ADHD, but typically it's not the same. Lots of kids with ADHD can have friends. And it's not an issue. But often in the middle is these, sometimes it's like being able to know how to negotiate because they don't sit still long enough. There can be language delays, sensory issues, attention problems, opposition. It can appear, I'll say the appearance of oppositional behavior, emotional regulations, trouble listening, for different reasons. It could look the same. What I always like to say, which Christine has heard me say several times, is whenever it comes to ADHD in general, I like to say, these three things. It can either be ADHD, what we would call part of the neurodivergency of like they really, and typically that's noted when they really respond to medication and they have the diagnosis, but they also respond well. They really respond to the pattern of the behavior, things that like different, like having a schedule, having predictive, having like things very clear to them, then they do better. But it also could be trauma. Children who have trauma histories or adults can look like they're ADHD, but it's not such a hyperactivity as it's hyperarousal. They always need to look around. And so it can look like, because they're always impulsive, they're always looking around, but it's not because it's something that they're neurologically is different as much as that they're trying to keep it's really about safety and protection. Or they could be the third thing, which is a sensory integration issue, which often comes with autism and the sensory issues that autism brings on. So, but you can have sensory issues without autism. So that's what I always like to say, because sometimes everybody, I've had families and parents who would say, my child does not respond to that medication. And I say, well, maybe it's because, it's not really ADHD. Maybe there's some other complications. If there's in vitro drug use for the child, that can also make them look ADHD, which I guess technically it is, but they can't, it's really different because that's not like they can't, their brain was changed because of the illicit drugs.
And there's a question in the chat says, how can I address motivation, a reduction in motivation to initiate or persist in goal-directed behavior?
Can you give an example?
I think it was Marilyn who typed that. Yeah.
Yeah, I just learned this term, amotivation, not a and separately is one word.
Like atypical. Mm-hmm.
Mm-hmm. And it looks like this, that they've given up trying. So we've gotten anxiety as a result of, I got to finish this assignment, and then they don't do it, and then it builds up. So now we have 4 that has to be done. And then it's like, it's no use. I just don't have the energy to do it, to fix it, to even look at people when I'm speaking to, I just have no motivation.
Right, the shutdown comes on. That's an excellent question, Marilyn. It was something I was actually doing in research for this training, and they were, and experiences I've had over the years with children especially, but even adults, where if they feel like it's like a form of perfectionism, where it's almost like it's almost like if I was having to write my name right here, and if I just couldn't get it right, then I rip the paper up and I have to start over, and I cannot handle the fact that I can't do it right. And part of that, and it's almost like then it's like sensory overload. And I think of it, this is like a progress of it, and maybe, it's like smaller doses of it. These are the things I think off the top of my head, maybe smaller doses, and really working on like the deep breathing of like kind of like doing it in a calm manner, maybe smaller amounts, and then maybe having them do get up and move around and not making it, because I think that sometimes if you feel like the issue is more where they're kind of stuck, it's like, you can tell them how we have to do some things to get unstuck. And, this is kind of part of the struggle is like we want, and also then motivate, talking about maybe, if there's other motivations that they would like, and that could be a way of looking at maybe there's some of their getting activities, getting some different, like we talked about earlier about physical activities, or getting them to calming activities that or maybe a special interest to say, if you do this for a little bit, then maybe you'll get some time with this. As long as you understand there's a timer, why don't you work on it for 10 minutes and make it short amounts and see, and help them to get like larger, because it sounds like it's overload now. And that's part of hopefully their IEP, that maybe they can, that sometimes, because I would say that could be a real issue for the IEP, that things can be turned in late, or that things can be maybe smaller amounts of that the rest of the students do, because sometimes there is because sometimes they have other processing issues going on that they're are going through. And so, and maybe just, this may sound silly, but maybe even writing it up differently. Maybe it was the same assignment, but putting it on a different thing so that they feel like it's something different. We're going to do this different and fresh. It can be something that's small that can make somebody like, oh, I got something. Oh, okay, yeah, let me try here, and breaking it into smaller chunks versus, I just know sometimes when I see papers like documents that are like long or even books, if I open a book and there's like, I don't like the font, I might not buy that book even if I want it, because of the fact is that it's the visual of like, if there's not enough space, that can make somebody think like, this is too overwhelming, I do not want to handle it. So maybe even breaking it down can help, and just making it that way. And then giving them a moment to go, if they would have something to do, like they have, depending on their age, if they that they like to do, as long as it's not distracting. Like I wouldn't say like, well, they can play a video game where they may never want to come back and cause another trouble, but that may be something to help them to get in there.
Thank you for answering my question. And we were denied an IEP because for a while they were able to mask because of the masking and it not being identified. So like in the process again of trying to like appeal the IEP, my level of understanding is down here. So
I have a book that I've given parents at times. It's called From Emotions to Advocacy. I'm going to see if I can find it and put it in the chat. It's I think it's, I want to say it's From Crying to Advocacy, but it's a little bit, I think it's from because sometimes it is those things like you have the right to ask. I feel like for some, that's, I think the biggest challenge when I think of children in autism with our high functioning, because I've had a lot of, that was really how I got into working with those who are on the spectrum, is because I had a lot of clients who were, again, they looked it wasn't very obvious that they had autism. And so because of that, they were treated like everyone else. And then that meant you were doing, that you were being defiant, that you were disrespectful. It was all the things that, because nobody understood them correctly. And then when they did, then we could work with them that way. And then often, sometimes depending on the school district, depending on the school itself, it's like, how much work is it? And that's why I always say to parents, this is for free, this on the side, is that, if your child acts out and they'll say, this is what I've experienced. Don't judge me, but I have experienced it where the people they'll say, your little Johnny, he did all this, he ruined the room. He doesn't have an IEP. But we'll be nice to you. And if you just pick him up and we won't give him suspended, I would say, encourage you to think about not like refusing that, because if you always rescue him, they will not be accountable, and they will not have to document that even if they suspended him. Sometimes people would rather say, here, take your kid home. And it's easier for them. It sounds like it's nice, but really it's to serve them. Then they don't have to do the paperwork if you just take your kid home. So that's just a little on the side. That's for free. That wasn't, but that's just some things. Marilyn, if you, you'll see my email at the end. You're welcome to email me, and I might give you have a couple other hints I might be able to give you in that area.
Karen, there was
Thank
one
you.
more, sorry. Karen, there was one more question. It was asking, sorry, I lost it. It was asking about children who are runners. If you have any suggestions about children who run, I feel that it is a sensory, but I am afraid they will get hit by a car.
Absolutely. That's, so I think that that's like, depending on if you're talking about at home or in a school setting, it's about really like, how do we have, like in place that the door, you know, that everything is, let me just take this off so I can, so we can kind of, when at that issue, I think of two things. I feel like, that there is, you know, you do everything you can in terms of doors or like, you know, locking things and that sort of thing. But it can be like, it can be that they need like a weighted vest. It can be if they're really struggling and agitated, how do we, before they get there, how can we give them a habit of like that's actually very easy to like has some control over. So it can't, like, I think of the weighted vest because it kind of brings anxiety. It can reduce somebody's anxiety. It can make them do that. If they don't have one of those, you know, there's a good, more of the device that they, like an ankle monitor, so that they're, you know, that they're safe, so they stay that, so that that can be tracked as well. I mean, that's just a pretty basic thing. But like, I would probably start with more, how do we continue calmness? Like what is the environment and how do we help them to calm in a safe place so that, and it's kind of maybe teaching them where a safe space can be. Sometimes in school settings, I've had it where they were encouraged, maybe there was a spot in the classroom or down the hall or someplace where that way. And it really, if it's in the school system, that they need to learn to, that there isn't doors that near that it's not easy for the child to get out, in the sense that they're, not that they're not easy, but that's kind of like problem solving. That's a problem solving with the you know, with those in charge there. How do they do that? But it can be that they learn to go to a room that they can calm and that they can sometimes get that, because at the same time, you think about running, that's a lot of good exercise. I mean, I'm not saying that to like, there's something physical as well as emotional that's happening. So maybe there could be an alternative, like a room that has some space that they can jump around, that they can get some other things done. I'm not sure. I mean, every child's different, but that's some of the things that come to my mind off the top of my head. Yeah, jump like a bunny. And sometimes if it's sometimes they need space. It's every child, every person is different at that moment. And it's really kind of teaching them, like, so right now, do you feel like you need to relax, or is it sometime where you need to kind of go, you know, let's do some, you know, having some silly music. Sometimes they don't want to hear music. Sometimes it's just like letting them to do things that, and kind of feeling that way. And so it's, you know, kind of helping them to do that, may be real helpful that way, to get them things. So the things that I come up, I think of that I've seen I've done with my clients, or I have seen them that way, and helping them to do that. I've had parents, because they were available, you know, it just took a lot longer for the school to say, this is your response, that is their responsibility. Because I just want to say that again, because I feel like that's often where parents, often children, it's really the job of the school has been legally, not the parents have obviously involvement, but what I mean is that sometimes when kids are really hard, it's like the school would prefer for you to just take your child. And I understand that in a humanitarian, you know, as humans, we can only handle so much, but that's really not a response that's acceptable. And often we have to give that pushback that, you know, what are you going to do about it? You know, like, no, this is not, it's okay for today that you know, I would prefer a manifestation hearing and a suspension than, and to go that route and to get advocate that way. Because what happens is if you always take your kid home, then there's no, and the challenges are at school, then there's no documentation that there was ever a problem. And sometimes we need problems for people to go, what should we do for Johnny? And that sort of thing.
Hi, this is I'm the one who posted it. This actually happened in my playroom. And this is the first time that he's ever done such a thing. Here, he had done running before, but after coming, he hasn't run in a while, but he had a bad day at school. And he came in that way. And I know it was sensory, but that never happened. I was super worried. I wish I could put a translator, but I think that's a liability issue. So
yeah, it can be, but maybe that's really a challenge. I mean, that is the risk always when we're working with our kids. That especially with the younger they are, I'll just say the younger they are, that because they don't have enough internal into them, like, this isn't probably a good idea. That they're more risky. That can be a real challenge.
Yeah, he's 5.
Let's move on so I can just share some more information here. Any more questions, you're welcome to do that. And again, my email is at the end if you have a question specifically there, if there's something I can help with. This was my introduction to really discuss a little bit of sensory. And again, like I said earlier, people write books on these things. So I don't want to, I'm not going to belabor it, but it's the good transition of us talking earlier about it. Was that a sensory experience, why the child ran and that sort of thing? It can be. And so part of even looking at her, like, what did she, in those situations, how do we give those little diets, those little things that can be helpful? I think for parents, it's just helpful for them to know that there are things out there, and maybe just how do we begin to calm, how do we bring those things to kind of help them learn to manage. I liked the fact that she had her headphones in the lunchroom, because I could say most of the people I ever knew that ever had that have autism struggled with being in those big spaces. I actually have an adult client who, for sensory, he has sensory overloads, and he actually is somebody who has a job, and he was working in a place that's like a warehouse. And so, he's a great researcher. And so he actually looked up, and eventually he went to the audiologist and got a pair of they're like custom made earplugs that are not like plugs like the kind you wear to go to bed, but or that you don't want to hear anything. They're actually meant to just kind of like, they're like hollow in the middle so that he can hear a lot of things, but not everything. So, but it just calms down the anxiety. And Christine and I shared this client for a while, and, it was remarkable how much that changed him, because just to be clear, is that is like that input that he normally was getting drained his energy. It made him more anxious, and it drained his energy. And when he started to wear them, he just had he was more positive. He was able to do things more. His outlook was different. And so that's just something that, back 20 years ago, the idea of kids wearing, having earbuds or earplugs was not as much of a thing, or at least not for the kids that I was seeing. Maybe for somebody who's more not as high functioning, but at the same time, now it seems to be more of a common, not such a big deal issue. But I do think it can make a big difference for those who are struggling. So I wanted to say, so how many senses do you think we have? Some people would say that we have, we all taught as little kids, there were 5 the senses, and sometimes they always think of a few more. But one of the ladies that one of the speakers that we had, one of the doctors that spoke last when we had the training, they said there's 22 senses, because and I was like, well, that's more than I was thinking about. So part of it is kind of like how, like I said earlier, we have the interception of how I right now feel my body, how my body is feels to me, and what it tells my brain. The proprioception is how I am in space, and the midline, how I can I can cross the midline to come to another space, and how I know how to like use my body. So if I want to drink a water, I know I can pick up the cup, and my eyes can tell my brain, this is how far the cup is. There's a whole lot we're just pretty amazing and complicated. And so and our brains learn those things as we grow up. We just learn how to do things. So sensory integration is the process of our brain getting feedback from all the things that are around it and inside of it, and how it processes it. Those who often with autism have sensory issues lead to having more. It's easily to be either over or understimulated by their environment or current situation. And so that's not everybody who has autism has a sensory processing disorder, but often there is sensory sensitivity, that's why we're talking about it. I have to tell, because I said, Christina, I was watching, looking some videos. I think the videos sometimes, break things up a little bit. And so there was this one I was looking at, like, oh, it was almost like kind of like a news one, but like a new, like where the two people were talking, and I was frustrated when this lady, she acted like she just knew something, and she said, well, sensory processing disorder really isn't a thing because it's not in the DSM, and doctors don't diagnose it. And I was like, I wanted to find her and say, you need to know your stuff, because it's not a mental health issue. That's why it's not in the DSM. It's a sensory processing disorder is a health disorder, and it's usually an occupational therapist that will diagnose them. I'm really not sure if doctors do. I've never known a doctor to diagnose someone with that. It's more of there's a specific tests I can go through. So, and that may be, again, if you have a client who seems to be clumsy, or there's other things that they're just really not they're not where they're supposed to be developmentally. That is an option. I had a client who I've referred clients to occupational therapy. It's a lot of fun. I find I went with my client when I had him home. I learned a lot through that, because what happened is that client, it's things that you think of when you think of a little child. If you know any toddlers or preschoolers, like the infants, once they start to move and all, infants and toddlers, they need to push themselves. They make a mess in your house. They pull things away, and they pull up pillows, and they crawl on the ground. And we think that, we have that's so cool. We like it, but we never, but what is amazing is that when they're moving like that, that's making their brain develop. And I think that's super cool. So really, when there's a problem with it, when something is off, what occupational therapy does is that it helps them to actually learn they're actually doing homework. They get a sensory diet that helps them. My favorite, this is a book that I have used a lot, which is called Out of Sync. Out of Sync is the original book, and this book I like more because it has fun. And what it is that the first part will actually explain what sensory issues are, and then it goes into a gazillion activities that are really fun, that are really very practical. They're like things you could do in your house, and that sort of thing. And one of my ones I often tell my clients to do is, they call it the jelly roll, and basically it's like you take the rug or like a good sized blanket or something, and you just roll the kid or an adult in it, and that's a way of almost like getting a hug without getting a hug. And even like when I think of, I know people who are sensory wise, their parents knew how to give them not just a hug like, oh, I love you, but like a hug like that isn't like that's that pressure and that sense of that can be calming. Now that of course that's not good for every autistic person, because sometimes people are very sensitive. So that's but there's something getting resource like this can be helpful, because even though it doesn't really just apply to those who are officially diagnosed with sensory processing disorder, there can be some really good tools and a lot of good things to learn. And so sometimes I've used this to kind of give suggestions to families so they can kind of help balance and stabilize in that respect. So that's just another, again, people have written books on it, and this is just one of them. So that's where I like to say that I just wanted to give some information, because sometimes it is a sensory experience as to why if someone is more hyperactive or inattentive, and that this is their ways to calm them down, and there can be that way. And with that, particularly with the one client that I really went and watched him, it really made a difference. And they had things he had to do at home, and it can be as simple as that, or it can be. It's not simple, but it can be a really neat way of a diet that can really make a difference to make somebody actually improve in that way. And again, I went back to the scheduling, and again, I want to watch, and I guess I want to say with expectations, because I feel like when it comes to sometimes what we want to get done, I mean, we all work and have very busy lives in the sense of there's a lot of things to get done. And sometimes we really expect, I mean, I think as adults, I just think that it's just not unusual for people to think I'm going to get, have these 10 things that I need to get done in this amount of time, and really be unrealistic about that. Well, if I'm not, but I have the wherewithal as a grown up that when I look at this list, and if I have 10 things on my list, I may know, okay, I'm going to probably get 4 of them done. Maybe if I 5, I'll be excited. But when you have somebody who has autism, they can't really cue into that as easy. And if I'm saying, but if I think I'm supposed to get 10 things done and I'm rushing somebody who has autism along, that could really affect the way I do how I plan. Christina, have you worked with any of your clients in terms of having a schedule or working on any of these issues?
Actually, we were just talking about this the other day. I had a client that came in, and we do a lot of verbal. This is what we're going to do for the day. And Karen and I brainstormed, and I'm going to put in my office, a schedule of when they come in, we're going to do some calming down activities because, right after school, they're hyper. And then we're going to, do the therapy and the exercise and the closing. And so the client can move the little Velcro person onto the next session so that she's aware of what's going on in the session, and we can kind of stay on track.
That's great. I remember I've seen, it's easy to find, like I've seen them online, where I think my first real experience was with a child who went into like a CSEP program. It was for autism particularly. So it was amazing. And it was that, because it was good for nonverbals as well. It was like pictures, and they would just move the pictures when they knew that they had finished that task. And that just takes a little time, but it can be a great thing in the end, as an investment to get them to go. And this is and that's why I mentioned executive functioning. Sometimes if those, executive functioning is really my ability to know that if I'm going to finish this task, this is what I have to do to finish those tasks. And those who have autism can have issues with them, as well as those who have ADHD. So when I think of it, it can be as easy, and when I know that by asking the question, if you asked your child, or if if someone asked you to take care of these 3 things, like I'll just say it's the child, Johnny, can you go take, go to your room and get your shoes and socks on, and don't forget to bring your, get that book off the shelf and your book bag. And I asked them, can they do that? And they would, most of the time it's no. And it's about so how do we first cue them, help parents have realistic expectations that they don't give them too much to do. It's like the classic one is go clean your room. Well, my expectations and your expectations of what clean room is may be different. And for a little, 7-year-old, it typically is, but, showing them, but also it can be that you tell them one thing at a time, because that's what they need right now, and to not be upset when you give them 3 things and that they can't do it, that they're not remembering. Frankly, sometimes when I leave the room and I need to go get something, I don't always remember. And it's not because I have executive functioning, it's because I got a lot on my mind. But so I want to give grace to kids as well. So another idea would, again, as I said earlier, is that you write it down, or you have them write it down. Well, that may take too long. But you could just say, or I also use fingers. I'm very visual, so sometimes I call it the fingers. What are the things that we do in the morning? Well, let's say it's 5 things. we have breakfast, we brush our teeth, we get dressed, we comb our hair, we get our book bag. And if you repeatedly say those things to them and you go like, and you use your fingers, what's the first thing? First I brush my teeth, or then I do this, then they begin to learn it. And that's an easy way to kind of get people to do it. Again, like I said earlier, communication, sometimes we talk too much when we want something done. Well, and I say this, like I'll say, Christina, I need you to go put your shoes on, we're going to leave. And then the next time Christina hasn't done it, and I'll say, Christina, it's almost time for us to go. And then I'll say, you need to please put your shoes on. And then the next time I say it, I might say, Christina, it's 9 o'clock and I need you to put your shoes on and we're going to be late. And I'll say all these things. And it's not that, Christina didn't listen. But at the same time, I recognize what is helpful is if I just said the same thing over and over again. Now we feel like we have to give explanations because that's how we are sometimes. I'm a talker. And but at the same time, it's really good. It's more effective for Christina if I just say this exact same thing. Christina, go put your shoes on. And then she'll hear. And then if I say it the second time, she's hearing the exact same thing, and it will more motivate her instead of sounding like wah, 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 wah. And so, and that she's not hearing everything, that it's actually the same thing that I'm saying. So that's something, sometimes it's retraining ourselves as adults to be concise and to not, and to kind of keep our frustrations, like you can tell them later after they did the chore, but the task, but at the same time, it can be real helpful if you do it that way. Okay, and so this is what I found very important. I shared this in the last, my last training as well, but I just feel like it's so important because of what, as Kim said, rush hour is 24 hours a day when it comes to autism. So it's important to recognize space. So again, I said earlier, sometimes having a calming space, space to transition, space to be by themselves and just kind of regroup their brain and have time to do things. Space to calm and to learn that it's going to be that it's okay. That sometimes we rush too often. And if that means that you get that somebody needs to get up earlier because that is what helps them to kind of get things done, then maybe that's something that needs to happen. That sometimes those who have autism, that it's a difficulty to do a bunch of things. That I'll just say it this way. Again, I might get tired if I had to do, a bunch of tasks, but I don't get as tired when I'm talking about the emotional part, understanding your social cues, understanding how I'm working with people. There's a lot of energy that they lose that part of that battery goes down a lot faster than mine does. And so sometimes they just need a space to just kind of regroup and be okay. It makes me think of like sometimes even car rides, I had clients, when they're strapped in, sometimes that was the most calming time for them because especially when this was a younger child, like I think he was 6 or 7, but I feel like it just kind of helped him to kind of feel that I'm here and I'm in this space and I am calm, which, sometimes kids aren't like that. I mean, sometimes they like to take their seatbelt off and that's, a whole different agenda, but it's important to recognize people need a little time to do that. And sometimes maybe if you think of, I need to do these like 5 things, if the person who has autism, it may be 2 or 3 things, giving them a chance to have a breather in the middle of that. That may sound like, well, how do we get everything done? Sometimes they'll be more efficient that way, and maybe they won't get it all done. But it's kind of recognizing that they're kind of like where we give people grace to recognize that's where that helping them to understand how themselves and to do better, so they can just manage it more. I can't read the last line because sorry, I just want to read that last line. What does that say, Christina? Because I can't read it.
It says help families and individuals evaluate schedules and priorities.
That's good. And that's what I would encourage, because sometimes there's the reality of people live in real world. They don't just live in a vacuum. So just kind of helping them to understand what is a good expectations. And that's where, as helpers to the families, whether we're therapists or we're kind of workers, or when we are with the family, or it's our family member, kind of like sometimes having someone objective to help you, like, oh, is that a really necessary? Does everything have to look perfect in my house to be okay? Does everything have, how do I do this in a way that's helpful so that they can be, so that it's realistic, and that we just let go of the guilt of things not being perfect, and that they sometimes aren't perfect, because none of us are. And that's kind of the challenge. I think we live especially in our culture, that's very perfection or like task oriented. And, I do all these things. And sometimes, just like Kim said, I see things that you don't, because I need to go a little slower, and just enjoying that, and just seeing how do we do the best with that. And everybody's different. And so I like to say that fidget and other sensory things can be helpful. And I have my little box here of mine. This used to be in my office when I was more in person, and I have my little fidgety things that I would have just sitting around, and people could squeeze them. And these were just for kids to do this. It's all pre-COVID, so we weren't worried about. I washed them off, I promise, but it wasn't such a difficulty. But even having something like this is just a smooth stone. It's not really that dramatic, but at the same time, it is. If it's in my palm, and that's something I can put in my pocket. And sometimes, sensory-wise, just having something in my pocket can be very helpful to help a person calm. And so I've shared this story before, but I had a client who really liked carrying a stuffed animal around with them. When you're 5, if I was 5 years old and I had my Pooh Bear with me, nobody would think anything. They're like, oh, that's so cute. Of course, if I was 15, you'd wonder. And if, of course, at my age, you'd really wonder. And so, of course, this is not appropriate. You wouldn't want necessarily a child to, who's budding into adolescence to carry around their Pooh Bear like they would when they were 3. So one of my clients that was more that they liked their stuffed animals. Then the parent found stuffed animal, like little figurines that were about the size of this rock. And that was really, so she would just carry them in her pocket. And so she knew she could feel the texture, and she could enjoy that. And she could, and that was a good feeling. So it may be it may seem like, I remember when fidgets came out, the spinner one came out a while ago. It was like, every kid, it was like a big deal. But I do think that there is something, and we can say that they'll drive you crazy, they'll do this and that, but you can teach them to do them in an appropriate way that can be, to use them and to feel them, and have ones that are quiet, because some of them, because if I was a teacher, this would, I can't have this going on the entire time, would be annoying. But at the same time, I think that Christina has a client and who has some ADHD. She's a teenager, but what she learned to do is we just told her it's okay for her to paint or to be doing a small task. It was funny, we had to tell the family, because the parents were like, you're supposed to be in therapy. And we're like, no, it's okay that she was peeling potatoes while she was talking to us. But sometimes when you have ADHD, if you have something to do with your hands while you're talking, and I use sometimes Play-Doh in the office, not Play-Doh, but Model Magic or something else that can be like that. Could be, it's a good texture. And you don't have to make something. You can just be playing with it, and that can make you focus. And so I would just encourage you to, that could be a real easy sensory thing. And then you learn to have them own it. Like one of my clients, the mom was like, oh, I just, I do have those here and there. And I just said, well, why don't you learn that he just carry it in his pocket, or he has it all the time, or you carry some and you're always in the car. They're always in the car. They're always in, all over the place. They're not, most of the time these aren't expensive. So like you just have a few here and there, because then that can make a difference. And if the person learns to carry them with them, that's more power to you. Sometimes I think it's a sensor. Our phones can be a sensory thing. Sometimes I just like to press the button. I'm not going to lie. So anyways, but that could be an opportunity to do that. Any questions? Like I said, there could be a whole lot of stuff. to be said, and I've appreciated your participation in this. Is there anything, Christina, that has been said that we haven't talked about, or that you and I had talked about, we hadn't talked about in this session?
Nope, I don't. There hasn't been anything new added to the chat, and I think we covered it all.
Beans, okay. Well, I have appreciated you being willing. This again, as I said, my biggest challenge was to restrain myself because there's a lot to be shared with these topics, and just to kind of understand how the mind works and to be respectful of them. This is our contact information. You are welcome to snag us and to have your question. I would appreciate if it was real specific, because we're with our busy schedules, I'm willing to help, but at the same time, I can't always look at a lot of information. If you really, I can give you some bullet points. It's probably the easiest way for me to understand, and in that way, we'll and move forward. My plan, I'll say it this way, my hope and my plan is that my next training would be later this summer. And Christina, you want to tell them what we're going to do?
We are going to discuss the transition from teenage into adulthood and resources that are going to be available, and kind of go around that, and kind of how to keep services in place. And that's our plan, is to talk about that.
Exactly. So we're gonna tackle adulthood, which I feel like is where both Christina and I just roll our eyes at how much how sparse it is to find stuff on adulthood. Like, it's not like, we always joke, like, autism continues. It's not like it's a childhood disease. It is often, or disorder, I should say, or struggle. It's not like people grow out of ADHD. A good percentage of people who had ADHD as children don't have it as adults, but autism continues. So we want to just kind of help that, and it's a big tackle. Right now I'm thinking of it, and that's why at first I was going to make that as one of the topics, and I thought this needs like a whole lot of time, and I want to do it right. So I'm hoping to have my goal is to have maybe a training that's going to be like how you would help parents and the caretakers, and it's more goal, like, because again, autism is broad, so some kids need to get into like maybe a day program, and some need help at college. So, or others, trade schools, and how to get a job. And then there's, then I want to have one that's actually, how do you work with the adult or the child, the teenager becoming an adult, and working with them to help them to know, to make decisions and deal with their predictability. That's my plan. And I'm looking at August as that. I haven't put a formal date because I was doing this training. So anyway, so if you guys, glad to be a help, and thank you so much for participating. If there isn't anything else left, then you can probably take the record off, and we will see you hopefully in the summertime. You have a good day.